legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, May 8th. I'm Brent Anier. House, Senate budget conferees are about a week and a half into their negotiation process, trying to find compromise between their respective chambers' budget proposals. TMA and 6 other physician organizations sent the group a letter asking them to craft a cost-effective budget that addresses Texas's significant healthcare needs. Specific asks include ensuring low-income Texans have timely, reliable access to primary care physicians within their communities, promoting a robust physician workforce to meet Texas's diverse and growing population, strengthening the state's public health system to ensure early detection of potential disease outbreaks and to better manage costly chronic diseases like asthma and diabetes, fostering early intervention and treatment of mental illness, and providing preventive health and wellness services to low-income women. We spoke this week with several top TMA physician leaders who were here for the last TMA's first Tuesdays at the Capitol, asking lawmakers to pass a budget that helps preserve patients' access to health care. Though the budget is far from set, cautious optimism ruled the day. First, here's TMA's new president, Dr. Tom Garcia.
I'm happy to tell you that I'm very optimistic, concerned, but very optimistic that the outcome of our legislative agenda is going to be very positive. We're looking forward to having increased funding to our Medicaid, to our preceptorship, to all the women's health and these mental health issues, and monitoring the telemedicine issues. We're very, very optimistic that we're going to have a good outcome. But as always, as we get close to the end of the legislative session, you have to be really attentive to the fine details, especially to unfriendly amendments.
Adding funding for graduate medical education is a top TMA priority. New TMA House of Delegates Vice Speaker Dr. Arlo Weltge, seen here with former trustee Dr. Lewis Foxhall and some medical students, visited several lawmakers' offices to urge support for GME funding and expansion. He and other doctors like TMA trustee Dr. Linda Villarreal explained the importance of GME funding. First, Dr. Weltge.
We need to maintain our current programs, and there are a lot of primary care programs that need support, and that is there as well. But ultimately, we need to expand the number of slots, and the rider that we have would increase the number of GME slots to 1.1 for every one medical student graduating, which means we will then have a net import of students doing their residency training as opposed to now losing students to other states for their residency training.
They're finally realizing that our graduate medical students, ready and willing and needing a residency slot, are leaving the geography of the state of Texas. And statistically, 50% of physicians who do their residency in the community stay in that community. And that, of course, relates to the significant decrease in physicians going into primary care, family practice, and internal medicine. So we are able to create more slots in primary care. That's going to provide your son and my daughter and their children access to health care. And I think that's at the end of the day, the bottom line is access to health care.
We caught up with Dr. Villarreal just as she and former TMA board member Dr. Carlos Cardenas were heading in to visit Representative Richard Raymond to ask him for support on several bills. New TMA Board Chair Dr. Doug Curran visited Tuesday with Lieutenant Governor Dan Patrick's staff, urging support for budget items too, including Medicaid payments for many primary care physicians that match what Medicare pays.
And we were talking mostly about the additional funding for Medicaid to allow Medicaid and Medicare parity. And that's enormous for our people. That's going to allow us to continue to see Medicaid patients in our office, and it's going to be such a help for them. And I'm excited that it looks like that's going to go. Our conversation was really good. She understood that this is going to help our people, and that's what we need to do. It also is going to keep physician offices open and keep them independent and functioning and able to pay their bills.
Dr. Clifford Moy, whose term as Speaker of TMA's House of Delegates ended just last week, summed up his thoughts about where we are with only 24 days remaining in the session.
There are some issues I'm concerned about with the budget. We are close on that, but we don't have a budget yet. The House and the Senate have budgets that are pretty close, but sometimes when they're pretty close, people stick to their guns and we end up with a special session. So we're all holding our breath and crossing our fingers that both the House and Senate conferees will come to an agreement, pass a budget the governor will sign.
I'm sure his concerns are valid. House-Senate budget conferees reportedly have agreed on several smaller points of the budget, but they have some larger points to hash out. Among them, which tax cut the legislature will adopt. You might recall the House is pushing for a sales tax reduction, but the Senate prefers a property tax cut. Dr. Garcia asks all TMA physicians to stand ready in the session's final days.
So pay attention to your legislative alerts that you get from the TMA and respond by calling your representative or senator according to the request that we ask of you.
You receive those action alerts in your email inbox. TMA will keep you posted if and when your calls to legislators might help push a favorable bill over the top. That's all for now. I'm Brent Anier with TMA. Please join us again next week for TMA's Legislative News Hotline.